Good afternoon, everybody. I am Sutapa Biswas from the Cancer Foundation of India. Sorry, I couldn't be with you today because it's midnight in India, but I still want to take this opportunity to be a part of this program, and I thank the organizers for including us as well. I go straight to the point. Cervical cancer is a burden in India, which is something that we all have to agree. And we need to address the problem because the numbers are going larger and larger. It is second most common cancer in India, and we need to have a strategy to control the deaths that are projected in years to come. We all know the solution, talked a lot about it. It's an elimination strategy given by WHO and the 1970-90. And to make it a reality, we need to work towards it. And we find that the cervical cancer incident ranges in India from 5 to 23 per 100,000. And we have to reach 4, right? So that is a huge task, and which requires that we need a very, very good planning. So to start with the challenge, the primary challenge that we have is population. As you can see, the sheer number of people that we have. It is 1.3 billion, of course, which is 4 times the population of the US, and India is 1/3 the size of US. So you can imagine the density of population as well. If we look at the cancer registries, that gives us the numbers of, how serious the problem of cancer is. There also we have a limitation because cancer is still not a notifiable disease. So we don't have all the numbers recorded because people don't report as much. We have 36 population-based cancer registries, and we need to have many, many more to understand the scale of the disease. The highest incidence, of course, is in Mizoram, one of the states in the northeast of India, and kind of low is in Bihar and Kerala. But I believe that the Bihar numbers will go up when we have a better registry over time. The numbers are increasing, as we say, and the point that is of concern for us is that 60% of the cases in India are reporting at the late stages, which means that we cannot really save those lives. They are not treatable at that point of time. And that, I think, is one of the major concerns for us, along with prevention, of course, that those who are coming in need to come in earlier. So cancer prevention has to be prioritized, early diagnosis has to be prioritized, but we cannot always have a treatment-centric approach to cancer control. We need to make people aware that there is prevention that needs to be worked on. If we look at the programs that the government had over years, since 1975, we had a program called the National Cancer Control Program, which later got merged with the other NCDs, the non-communicable diseases, because they said it's an NCD, so let's combine and make a larger program. So it got clubbed with, diabetes, cardiovascular diseases, and stroke in 2010. And that's when it became a little more difficult, though the program is much, much larger. But the management for cancer, the strategies for cancer control is different from diabetes. It's different from cardiovascular disease and stroke. They might have a few common risk factors, but the approach cannot be the same, because in cancer, we see you have breast cancer, there's one kind of planning. For cervical cancer, one kind of planning. For oral, there's different kind of a planning. So it is extremely difficult to club them together and have a successful program. I hope that, sometime in years to come, they will bring cancer out of it, and it will have a separate program of its own to have all the strategies incorporated really, really well. So India came up with an NCD guideline, screening guideline in 2016. That's what we continue with now. But most of the resource allocated by the government is in building infrastructure for treatment. It's very, very hospital infrastructure building, on other resources, mainly in the larger cities, not as much in the smaller places. If we come to cervical cancer control, we still don't have a clear strategy to reach the 2030 targets. It is good that we have been a signatory to it, but we need to have a planning in order to achieve what we are heading towards. We see a large number of girls who are eligible for vaccination. We have much, much larger number of women eligible for screening. So we need to decide which one do we take up and how, because see, India is a low resource country. So whatever resources we have, we need to allocate them well, optimal utilization, as we call it. We need to work towards that. On other side, we need to reduce the mortality. We need to treat them. 80% of cervical cancer cases, again, report very, very late. There are a lot of barriers to it. They're cultural. India is a very, very different kind of a country. As we say, one country has many countries in it, different culture, different language, different social norms. So it is very difficult to have one program that will fit in everywhere. It needs to be worked upon. So we have poor access to healthcare because India, again, is spread out. We have to have enough resources for people to reach out for any kind of preventive services. If we look at the cervical cancer risk factors, we need to work on women, right? They need to, the literacy has to increase, but more than that, they have to be empowered to take their own health decisions. They need to work on their hygiene. And along with it, the government programs that are there, they need to be strengthened more and more so that women get the benefit of these programs. If you look at cervical cancer screening in India, as of now, we have had mainly in research settings or campaign mode, which of course has limited coverage. But Tamil Nadu as a state took it up into 2010, and which I think is one of a very, very good example for us to look up to. NCD screening guideline of 2016 talks of cervical cancer screening with VIA, which also needs to improve, and we should move towards the HPV test. But if we look at the numbers issued by the ICMR NCTIR, the Informatics and Research Center, which says only 2.2% women are actually screened. So screening isn't working the way we thought it would. It is an option, but it is not working the way it should. And many say that, cervical cancer is coming down anyway. Why do you need to work or allocate resources for India? We say that we need to accelerate the process. It is very, very important that we do that. If we come to HPV vaccination in India, it is approved. It's available. One can buy it off the shelf and vaccinate their daughters. But at the same time, we are looking at that being included in the universal immunization program, ensuring every girl in the country getting it for free. That is what we are targeting. A very good IR multicentric study started in 2009, which is giving very good results. We have evidence for 2 doses, which is a reality, then evidence for 1 dose, which is a SAGE recommendation, as we all know. And we have enough data in India, which actually gives that it is safe and effective. We have 3 vaccines available in the market, but the good news is that India has developed its own HPV vaccine called Servavac, announced this month, and it's going to cost 1/10 the price of the current vaccines. This is a game changer for LMICs and India. Everybody can take the benefit of this. If you look at the vaccination programs done with all these limitations that I talked of, Sikkim started in 2018, which is a small state. They covered the entire state. They're continuing with it. Delhi started opportunistic in 2016. It's one example where you see that though they gave it for free, but they want too many takers. Punjab, Orissa has announced in 2022. Tamil Nadu is yet to announce, but they are planning. And all these funds are coming with Gavi support. Gavi has really brought down the price, and through UNICEF, we all access it. So we are talking of increasing the uptake of HPV vaccination. We need to talk to the policymakers. We need to talk to the medical community, gynecologists, pediatricians, the general physicians, the paramedics, the parents of adolescents. That is very, very important for us. For that, the American Cancer Society came up with a behavioral research. They said we need to find out why there is hesitancy, why the physicians are not confident. So a research study was conducted, we took it up in 2019, and it was conducted by the CSBC, the Center for Social Behavior Change of Ashoka University. So they started to take a qualitative study to diagnose the problem, what are the barriers, and then we came into designing the interventions, what could be done, and then it was evaluated in 2021, last year. So it was done during the COVID time. It gave us results which says that the physician champions are the most trusted source of information for a parent, right? Then talking of having a communication toolkit, helping the physicians navigate the conversations. How do they talk to the parents? Then, of course, we need to increase the salience, as we can see, while nudging conversations, we need to increase the salience of it. We looked at medical societies. There are many which are there, but we narrowed it down to working with AOJ in India, FOGC, the Indian Academy of Pediatrics, and of course, Indian Medical Association, which is one of the large organizations of doctors in the country. So the communication toolkit, that's what I come to at the end, that we are working on at the moment, and we are going to present it at the World Cancer Congress in Geneva next month. And this toolkit is going to have actions where we will have the medical society working on it. They will have to alert the physicians about HPV vaccination, cultivate champions within the society, and of course, recognize the success of these champions. They need to work. And in order to do that, a very well-planned action steps are given. And ACS has really, really helped us a lot. They're still working on it. And the resources are PowerPoints, fact sheets, posters, video. So anything that they can refer to is going to be there in that kit. So what we are looking at is this action guide being adopted by Gynecological Association, the Pediatric Association. We would also think of having an HPV roundtable like you have in India, and celebrate cervical cancer survivorship. That's also very important. People don't talk much about it. And eventually seeing all girls getting vaccinated and cervical cancer is prevented in India. Thank you so much. If there's anything more that you would want to know, please feel free to write to me. Thank you so much and have a great day.